Hi, my name is Dr. Narang and I'm here today to interview Dr. Ratan. We're here today to talk about the Dark Circles Clinic. So I'm going to ask you some questions if that's okay about the Dark Circles Clinic.
Thank you for coming to see me.
You're welcome. Can you tell me a little bit firstly about what dark circles are and why we get them?
Sure. So what it is predominantly for Asians and for people with skin of colour, our melanocytes around the eyes, so the cells producing the pigment melanin, are very easily triggered.
Okay.
It tends to happen in youth and it tends to get worse as we get older. So that's the most common reason for why people of skin of colour have dark circles. Right. Sometimes you see it running in families and then you know it's a genetic hereditary issue. Sometimes you'll just have one person in the family that has it, and that's because that person's cells are easier to trigger than somebody else's. And that's simply the reason why some people have severe periorbital hyperpigmentation, we call it, compared to other people.
Okay, and tell me a little bit about your Dark Circles Clinic if you can.
So what it is we're the only specialist centre treating dark circles for coloured skins. The reason is that we're treating the periorbital hyperpigmentation. So that's the key issue here. The other thing that we do is we stimulate collagen production for the skin around the eye. So we're basically giving you younger, healthier skin. So dark circles obviously appear less dark. So it's a two-prong attack when it comes to treating dark circles.
Okay. A lot of people believe that, for example, there are miracle products for curing dark circles, like, firstly, lifestyle, like sleeping more or drinking more water or eye creams. What do you think about that?
So in terms of, for example, not sleeping, I'm sure we're all well aware if we haven't slept properly, we are going to look like we have dark circles. And the reason is we get something called vasodilation. And that just means that the blood vessels around the eyes expand. And when that happens, it appears as if you have a blue tinge around the eyes, and that's, the appearance of dark circles. And a similar thing happens if you don't drink enough water. So if you get dehydration, the skin becomes translucent and dark circles again appear darker. However, if you're drinking enough water, you're sleeping properly, you're not smoking, and you're not drinking alcohol or too much alcohol, and you still have dark circles, then you know you have periorbital hyperpigmentation.
Okay.
And that's what we treat.
Sure. And tell me a little bit about the treatment. So the step I know you're going to be showing us a video later on, but a little bit about what the steps are for the treatment. So if I come in, how does it work?
What to expect. Yeah, absolutely. So first thing we always start off with is a free consultation. That's really important because we need to assess if this is the issue that you have, periorbital hyperpigmentation. If it is, then we proceed with a patch test and we do your consent form. Then we give you two creams. One is your numbing cream, and one is your priming cream. Your priming cream you take away with you. You apply every other night for a few weeks, and then you come in for the treatment.
Right.
On the day of the treatment, 2 hours before you come in, you numb the skin. And so it's a cream that we give you. And then when you come in to see us, we gently derma roll the top layer of skin. So we make tiny little holes in the top layer of skin. So that's doing two things. One, we're stimulating collagen. But the second thing we're doing is we're creating microchannels so that when we apply the mask, that penetrates down to where the cells are to start to calm them down. That's the root of the problem. You go home with that mask on, leave it on for about 5 to 8 hours. Then you wash it off and we give you creams to wear for the next 8 weeks. Right. The results are basically seen about 8 to 12 weeks after treatment. And one treatment gives an average of about 50% reduction in pigmentation.
So in terms of expecting improvement, you think that would be about 50% or?
Yeah, after one session where the average tends to be about 50% reduction.
Right.
Some people are looking to get the skin as clear as possible, so they tend to go for the bulk, the three sessions. That gives an average of 80% plus reduction. So it really depends on what you're looking for, which package is better for you.
Okay. What about side effects and pain? Because obviously that would be something that would be really on my mind.
I know, of course. I mean, me, myself, I'm not a big fan of pain. So that's why we give you the numbing cream. So what we do is with the numbing cream, you really shouldn't feel any pain at all. You might feel a bit of prickly sensation, a little bit of discomfort, but nothing that's, too traumatic. And if you do feel any pain, we just apply more numbing cream. That's all that is. When it comes to side effects, we make sure we do a patch test on everybody to make sure that there are no reactions. That's essential before you do any professional treatment.
Okay. And you've told me a little bit about kind of expectations. What about dark circles returning or like a relapse? Do they ever come back?
Yeah, so people who have dark circles, you know that your melanocytes are easier to trigger than somebody else's. That means that you have to protect your skin after you've had treatment. That means that you need to be very good with your sunblock, your SPF 50, be good with your shades, and just don't allow things to re-trigger. So for example, if eczema was the thing that triggered it, then you don't want to have an eczema flare-up, for example. Yeah. So it's really just about awareness, education, and protecting your skin.
Sure. Is the treatment suitable for men and women?
It is. So that at the Dark Circles Clinic, we really do have an even split. It's 50% men and 50% women. I think a big reason for this is that women get to wear makeup, get to wear concealer, and men don't necessarily do this as much. And so I think men have that insecurity when it comes to dark circles and they want to get it sorted. So the clinic is open to both men and women.
Okay. And are there other treatments on the market for dark circles and, you know, especially in coloured skin?
Yeah, absolutely. So what it is the classic treatment for treating dark circles up until a couple of years ago was fillers. However, fillers are great when you've got volume loss. So this happens with age. And that's what that treats. It doesn't treat periorbital hyperpigmentation. So it doesn't actually treat dark circles, which is what we do at the Dark Circles Clinic. Other people might even use some of the treatments designed for melasma, for Caucasian skin, and then apply that for dark circles in coloured skin, and that's absolutely the wrong thing to do. So those classic treatments would be things like glycolic acid, TCA peels, laser, and hydroquinone. The reason is that you can burn with these treatments, and if you've got coloured skin and you burn, you get more pigmentation. So you definitely shouldn't be wearing them. But the second thing is that they can thin the skin. And actually, like I've described before, what you want to do is thicken the skin. You don't want to thin the skin. So these treatments really aren't suitable for dark circles, especially for coloured skins.
One last question. That would be if I wanted to book onto the clinic and get the treatment going, how do I go about it?
So it's very simple. What you do is just book in for a free consultation. You can do that online or by calling our call line. And you come in and first thing that we do is assess your skin. We check that the treatment is suitable for you. Then we do a patch test, your consent form. We give you your priming creams and we book you for your treatment a few weeks later.
Thank you very much today, Dr. Rattan. I really enjoy coming to see you.
Oh, thank you for visiting. I really appreciate it.
You're very welcome. I've obviously learned a lot about dark circles today, and wishing you all the best for the future.
Oh, thank you very much.
So please do look at the website for more details about the Dark Circles Clinic, and please book in for a free consultation.